I'm Yvonne Okwara Matole. This is Citizen News in brief. We'd like to begin with the very latest regarding the COVID-19 situation in the country. Health Cabinet Secretary Mutahi Kagwe is warning Kenyans against getting vaccinated in unapproved facilities, saying they face health risks. While issuing a status report on a state of vaccination in the country, Kagwe said they were investigating facilities that had not been approved by the Ministry of Health, but were offering the vaccines, yet they do not have sufficient cold chain facilities. His warning extended to politicians claiming they were organizing vaccination drives outside the MOH-approved centers. He called on the Kenya Medical Pharmacists and Dentists Council to deregister individuals and facilities defying government directives on the matter.
It has come to our notice that some politicians have begun to politicize the vaccination process for their own political gains. This is not only immoral, but unacceptable and very disturbing. This has the potential of endangering the lives of our people and the public in general. The Ministry of Health would therefore like to issue a very stern warning to any person with the intentions to pilfer vaccines from government facilities that will face the full force of the law.
You only go to a Ministry of Health designated vaccination point where we know and we can be able to vouch for the safety and the storage conditions of the vaccines. You should not get vaccination from any other point. And I appeal to the healthcare workers to ensure fidelity to the oath that they swore to ensure the public health of the people by not being compromised by politicians and other people, to ensure that they break the rules and regulations that we have put in place to ensure public safety in terms of vaccination deployment plan.
We do have some defaulters. We have been looking through our chanjo system. About 100,000 people, by the time we began the second dose, have not received their second dose. And a bit of it is because of what we've said. Some are saying, I'm waiting for Johnson & Johnson. I want to get Moderna or I want to get Pfizer. We are really telling them, AstraZeneca is also there insufficient. You need to get that second dose because we've not adopted the policy of mix and match yet. And what we'll be doing is through the chanjo system, we are going to be getting alerts on anybody who has defaulted, and we are going to work with community health workers to reach to those that are going to be defaulting.
Meanwhile, the COVID-19 positivity rate is at 9.7% from statistics that were announced by the Ministry of Health. Mutahi Kagwe says 346 people tested positive from 3,553 samples in the last 24 hours. Now the death toll has risen to 4,720 people after 10 succumbed to the virus, all being late deaths reported after conducting facility record audits on diverse dates this month. Meanwhile, 1,951 patients are currently admitted in various health facilities countrywide, with 148 patients being in the ICU.
I also want to urge the political class of whatever level that it is getting to a point where you are frustrating us as the Ministry of Health. We cannot have this nonsense of 3 steps forward and then we come back all the way to where we were before. We have no bed capacity. Our isolation facilities are full. And yet, people still continue, in causing crowds to come together. We cannot continue like this, people. By the end of the day, if that happens, and we saw it in Kiambaa, we saw what happened in Kiambaa. We saw the results of the campaigning period in Kiambaa and what happened in Kiambu, where we lost a lot of people. It is obvious. It's very obvious. If If you call crowds in, if you go campaigning, it's obvious that you will kill people. So what is the political cost? What is the political cost that we want to bear when all we are going to do in the coming future is just burying our people? So I once again urge our political class not to be the cause of the problem, rather than to participate in being the solution to the problem.
One person has died and another 4 injured after a trench they were digging for a water project caved in on them in Kianderi village, Kirinyaga County. According to the Kirinyaga Central Deputy County Commissioner Daniel Ndege, 4 have been taken to Kerugoya Hospital. He says all the workers on the section of the construction have been accounted for.
Mara ya kwanza tuliambiwa watu kama 7 wamefunikwa, lakini after the rescue efforts tumegundua kwamba watu ambao walikuwa wamefunikwa kwa mtaro ni watu 5, na 4 kati ya hao wameweza kusaidiwa, wamefufuliwa wakiwa hai na wamepelekwa hospitali. Unfortunately tumepoteza mtu mmoja. Kwa hivyo at the end of the exercise tumehesabu wale watu walikuwa huko na tumehakikisha ya kwamba watu ambao walifunikwa ni watu 5 ambao mmoja wao amefariki, ametuaga.
The university's academic staff union, UASU, has suspended the public university's lecturer strike that was set to begin today. Secretary General Dr. Constantine Wasonga has said in a statement that the suspension was to give another stab at dialogue to resolve the stalemate. The union, representing lecturers, called for the strike over what they said was failure by universities to implement the 2017-2021 CBA. Wasonga insists that the Inter-Public Universities Council Consultative Forum is in contempt of court for failing to implement that CBA. Human rights activists are now demanding justice for over 200 missing Kenyans. Speaking in Mombasa while marking the International Day of the Victims of Enforced Disappearances, the activists claim that Kenya has recorded 13 cases of enforced disappearances from January to July 31st. 5 of the victims were found dead with marks of torture, while 8 are still missing. The lobby groups are accusing the police of contravention of the law. According to Missing Voices data, Kenya has recorded 227 cases of enforced disappearances from 2017 to date, 167 said to have been killed by the police or disappeared in the year 2020.
Kwamba swala la kupotezwa kwa watu limekomaa katika nchi hii. Kwa hivyo tunataka vitengo vya kimataifa viingilie kati, United Nations waweze kuangazia swala hili.
Isitoshe, wengi wao wanaopotezwa ndo breadwinners of the families. Wameacha familia katika hali tatanishi, hali inayokuwa ngumu katika saikolojia na kiuchumi. Ndiposa tunaambia serikali, iwapo wataweza kuwashika, wawatake investigation, wanataka maswali kutoka kwao, basi wao washike na wapeleke kotini, washtakiwe kama wana uhalifu wote.
Let's take a look at some news on the regional front. Zambia's new president, Hakainde Hichilema, has replaced the country's top military commanders and the head of the police and signaled a focus on the security forces being more accountable to the citizens. The president late Sunday announced new commanders of the Zambian Army, the Air Force and the National Service and their deputies, as well as a new Inspector General of Police. All regional police commissioners have been relieved of their duties, but their replacements have not been named. Hichilema said the new office bearers, quote, must have the interests of the people at heart and serve the country diligently while ensuring human rights, freedoms and liberties are respected, end quote. From Zambia, let's now focus on the situation in Afghanistan. The U.S. military has said it is investigating claims that at least 9 Afghan civilians were reportedly killed in a drone strike which aimed to prevent an attack on the Kabul airport. U.S. Central Command said the strike targeted a vehicle carrying at least 1 person associated with the Afghan branch of the Islamic State group. Information being shared by Kabul residents suggests 4 young children were among the casualties. A relative told U.S. network CNN that all 9 people were members of one family. A U.S. Central Command statement acknowledged that there were a number of, quote, substantial and powerful subsequent explosions, end quote, after the strike hit the car that was being targeted. All right, let's take a look at the very latest in the world of sports, and it's some good news for Kenya, having bagged its first medal at the Paralympic Games in Tokyo, Japan, as Nancy Chelangat, guided by her brother, won bronze in the women's T11 category. Michael Kinney with the details.
There is additional distance. You can see it's tightly bunched. For the first time, probably, they're guiding fit. We've seen it in the distance at these championships.
Of the World Championships in 2019 for Azerbaijan, and
Nikafika 200, kaniambia umefika 200. Ngangania jela, karibu tushika hawa, twende. Nikaenda. Nilikuwa nataka medali yoyote. Nilikuwa nimesema chana. Mungu anibariki, nikuje tu na yeyote.
Victor Kipchirchir Rotich won the Machakos 15-kilometer Great Run, with Jacqueline Chelai dominating the women's race. Kipchirchir, who also won the Eldoret City Marathon, finished the race clocking 41 minutes 51.43. Emmanuel Bohr was second, stopping the timer at 42 minutes 4.86 seconds. Reynold Kipkorir was third. In the women's race, Chelai clocked 48 minutes 48.65 seconds. Sharon Kimboi second, almost a minute later. Pauline Escon rounded off the top 3 positions. Now in the men's 10-kilometer, Liki Kamina was first, while Pauline Kaveke triumphed in the women's race.
Race haikuwa mbaya, ni ile nilikuwa nimejiandaa. Nilijua kuna tough competitors, so nilikuwa nimejiandaa vile vile.
Hii ilikuwa race yangu ya kwanza kukimbia 15K, kwa sababu nilikuwa najitayarishia kwenda Madrid Marathon.